Okay, it is coronavirus, and for 18, it is the second last day of the stay-at-home rules too. And surprisingly, we have lower cases, but still, it's still in the high. So we currently have 2,791 coronavirus cases today. So 931 cases are from high cases from Toronto. 653 high cases are from Peel Region. 275 is from York Region. 147 is from Durham Region, and 128 is from Hamilton. So I'm going to talk about after this I'm going to talk about two topics. But anyway, the case average is now at from all other regions it's under 125. So okay, so that's good. It's lowered. However, 25 deaths have been reported today, and there isn't that issue. So, of course, I want to talk about variant cases. So, variant cases, it literally took another step up with UK variants now at 77,649 cases, which is just absolutely alarming. An increase of 2,303. 309 South African variants, which is a +8, and 971 Brazilian variant, which is a +51. So the Brazilian variant is almost near 1,000. So in a few days, it's going to probably reach 1,000. That's just looking at the numbers. I'm going to assume that. So if you want to get vaccinated, apparently there might be they're lowering the age group. Probably most likely they're going to do it 30 years and up, or like that, and then sometime like by May 20th they're going to do 18 and up. So if you can book a vaccine on the web server, which has specific requirements. So you can book on Go to covid19.ontario.ca/book vaccine, or by phone, a toll-free number by 1-888-999-6488. And with they will be using a Pfizer BioNTech vaccine and the Moderna vaccine, so it depends which one they'll use on you. And at a pharmacy, you will have to wait. That is if you were eligible, but or your doctor recommended it, but it doesn't show up on the website like it did for me. Like, oh, come on. So they will like pharmacies like PharmaSave, Shoppers Drug Mart, Rexall, Guardians, Costco Pharmacy, Walmart Pharmacy, Loblaws Pharmacy. And basically every other place that pharmacies and Mounts, and then sometimes, and also some hospitals at Mount Sinai. Yeah, they will be doing that with the AstraZeneca vaccine, which people are very wary of taking because of the blood clotting, and which is rare, but it happens. And it's not as effective as the other the Pfizer BioNTech vaccine. BioNTech vaccine and the Moderna vaccine, and upcoming Johnson & Johnson single shot vaccine. Now, stay-at-home order rules is only until tomorrow, and that's it. Rules are down below. If you're crossing into the Ontario-Quebec border for any specific reason, please make sure that you are following the Ontario-Quebec both border rules. Quebec's also picky. Okay, so there's two things I want to talk about. One is Ontario might shorten the length of the time between coronavirus vaccine doses, and they are looking to mixing and matching doses, and the Pfizer BioNTech vaccine doses are being shipped. So apparently 785,000 doses for Pfizer BioNTech. So Pfizer Incorporated is going to send that, and in June they're going to send 938,000 doses. So that's good. So Health Minister Christine Elliott said on Monday that the added supply might allow the province to shorten the current 4-month interval between first and second shots, so people can get their first and second shot in less than probably in less than 1 month. So this also allows like the people who have to wait for the second doses to get shot right away. We can clear it, clear it, done. Speed things up. And if that happens, people will be contacted to arrange a new time for their second appointment because they already booked their first appointment and second appointment, but if the dates, if this happens, the date's going to change. It's going to be more earlier. This could, you know. Because Pfizer Incorporated recommends a 21-day, so 3 weeks interval between its two shots, while Moderna Incorporated recommends 4 weeks, and AstraZeneca advises 4 and so like. It was like 28 to 84 days, like, yeah, that long. So, 388,000 Moderna vaccine doses are going to be shipped next week. Hopefully they don't lower the batches like they did the last 2 months. And Oxford AstraZeneca has not mentioned how much they're going to send. So, Dr. Barbara Yaf is the Ontario's Associate Medical Health Officer of Health. That Ontario's looking on mixing vaccines, so mixing 1 and 2. There's a word soon to come from the National Advisory Committee on Immunization to make recommendations about mixing vaccines. So they're like mixing the Pfizer BioNTech vaccine with the Moderna vaccine, AstraZeneca vaccine, like, so like. So apparently they recommended that it's safe and effective to use a different vaccine for the second shot if you cannot get the same one you got for the first one. So although this might not be a good idea because I got the Pfizer BioNTech vaccine and the Moderna vaccines. The first shot is weaker and the second shot is stronger, but from what I've been told. And the AstraZeneca vaccine, the first shot is stronger and the second shot, so technically you get a super strong shot and it's another strong shot, and yeah, some people might have then if they use mixed in with the AstraZeneca vaccine, there is the risk of the blood clotting. And of course the Ontario government has been lousy. Remember the India variant, double-mutant variant? Yeah, they screwed up on that. Also, they screwed up with the long-term care homes. What's next? My second thing I want to talk about of order is 8 people from the Greater Toronto Hamilton area were like charged for following a gathering at a Muskoka cottage. So 8 people from the Greater Toronto area have been charged following a gathering that took place at a cottage in Gravenhurst, Ontario. You know, cottage country. So since the stay-at-home order is in effect, that kind of act. Come on. So technically, they're breaking the EMCPA rules. Which is the Emergency Management Civil Protection Act. So so gatherings of any kind is not tolerated, and we're trying because we're on a third wave of coronavirus, so we're trying to make it worse. We're trying to better, but people are making it worse by doing this. So the fine for violating, of course, the EMCPA rule is $750, and I've heard from Portal Police that there's a $130 surcharge. And anyone who anyone who organized and planned these events, organizers, they will be charged $10,000. I believe that's the new rule. Yep. And there's a $1,000 rule for the charge for if there are like people trying to prevent others from following coronavirus regulations and stuff. Like, so these anti-people who are trying to prevent the people who are actually trying to follow rules from doing that. So there's people who are going to be charged by that. And not only that, another thing happened. So this is 5 people from in Ontario. So 5 people from different addresses in the Brantford area. So that's have been charged after riding in the same vehicle, which got stopped at a Timmins ride check during Ontario stay-at-home order on Saturday. Of course, because if it's not essential, there should be no reason you should be So the reason why they stopped these people was because these 5 people, they probably wouldn't even know if that they came in contact with anyone with coronavirus or any of the 4 variants, and of course they could get in the same car, and they could affect at least somebody or the other like people in the car, and you see where that goes, right? And then they go back home, and then they really affect their family members, their loved ones, maybe they got kids. It happens like this. So gatherings with anyone outside of one are not allowed, except for like maybe there's a person who is living alone. They can be invited, but no one else. So this would have happened on Saturday. So Timmins police. So these really doing ride checks, spot checks, like making sure people were following the rules. Okay. So this happened on Highway 101 near Highway 655 in Timmins, Ontario. The Timmins police said the officer on that occasion stopped a vehicle with 5 adult occupants from 5 separate addresses. So then they're also breaking the coronavirus regulations and also the EMCPA. So that all 5 the people riding in that vehicle was served with a provincial offense notice outlining their offense and however they're charged about $880 each, so that's sort of different. So they've been fined $880 each for fine upon conviction or a guilty plea. So Timmins police said that it was the first time that they ever had to lay charges under the Ontario's EMCPA. So it's good that these officers stopped the 5 people from Brampton, because who knows like what would have happened if they did the Timmins police didn't stop these people. So this is So this was a ride check, not a random stop it was originally planned by the Ford government. So a ride check, that's there's a certain checkpoint where if they're making sure people are following the rules, so they're not breaking the law or anything like that. So this is completely legal. Cause it is not so it's they don't so anyone who goes through gets stopped at a ride check stop is basically they're just making police are just making sure people are like following rules. It's studied, you know. So thanks to Timmins police for stopping these people from Brampton from breaking our rules. There's sure like some rules might be like a bit too much, but if people are like taking it like you know, if people are like, literally breaking the rules and acting like they're right, like, I can do whatever I want. No, they're literally making it worse for the rest of us. So hospitalizations is now at 2,167 people hospitalized with coronavirus, which is an increase of 242. Oh no, this is just bad news for the nurses and hospitals. 886. In ICU, so minus 3, and 609 patients in ICU using a ventilator, so that is like minus 2. So long-term care home death is still at 3,760 as reported by yesterday. And also 50 outbreaks right now, so there's nothing changed about that. So please follow coronavirus safety rules and regulations and stay-at-home rules. Coronavirus safety rules, yeah, that's still going to happen until who knows when coronavirus is over. Stay-at-home rules ends. Tomorrow's the last day, so the Thursday we're home free and back to color zones. So don't have any gatherings of any kind. Don't screw up like those people who met in Gravenhurst, or those people who got stopped by the Timmins police from Brantford. And if you're going across the Ontario-Quebec border for any reason, please follow the rules. Remember, your rights aren't more important than the rest of us trying to lower coronavirus cases and ICU patient numbers. Because coronavirus cases numbers have sort of decreased, but variant cases have literally gone through the roof right now. And I've heard nothing but bad news from critical care nurses from hospitals, and they have to go through a hard job. So I give my condolences to them. So please follow the rules. Do not, have any gatherings. Not a smart idea. Stay safe. Stay-at-home rule 2 is over. tomorrow. The last day. Thursday, back to color zones.